Hi, Food for Health volunteers. We are so excited to welcome you back to our kitchen, and we missed doing this volunteer orientation in person, but because so many of you were coming, we are sending you a video to keep everybody socially distanced and safe. So a few changes I wanted to let you know specifically for the kitchen this year. We have a little bit of a schedule change where we are spacing everybody out a lot more and having less people per shift. So we've added some Wednesday shifts, as many of you have seen. So we're changing up how we do things a little bit, and you'll learn that next week when you come in, but we'll have a full day of shifts on Wednesday as well in order to space people out. We have changed the time slightly of some of the shifts to make sure that we have no more than 10 volunteers in the kitchen at any one time. You will be asked to leave promptly at the end of your shift and not stay late. And we ask you also not to show up early for your shift, but to come on time just to avoid a logjam of people coming and going at the door and temperature taking and keeping everyone socially distanced. So we are going to keep everybody to their scheduled shift times. We ask that you work separately at prep tables, one person to a prep table, in some cases possibly two, but as much as possible keeping that 6 feet of distance. Only one person in the walk-in fridge or freezer at a time, only one person in the pantry. Again, you know, there are times where you'll have to walk around people, but trying to keep as much distance and keep everybody safe as possible. Each shift will have to do all their own cleanup and dishes at the end. Our afternoon shifts used to have dedicated sanitation volunteers, and with our decreased number, we'll no longer have that. So probably about a half hour to 45 minutes before the end of each shift, depending on how many dishes and cleanup we have to do, we'll ask a couple volunteers to start that process as well. So we appreciate you being flexible and doing everything we need to do to keep it clean and get all our meals out. Lastly, as Susan kind of mentioned, with the limited number of volunteers we're allowing in the kitchen at any one time, it's going to be really important that everyone show up if they're able to. Obviously, we know if you've traveled or been ill, we do not want you to show up, but it's going to be important that you let us know so we can get sub information out to people. So if you want to pick up extra shifts, there's going to, I think, be plenty of opportunity to do that. And for our teen shift as well, the big change we've made this year is that our teens we've scheduled for every other week. The teen response to our program has been overwhelming, and we did that in order to get as many teens in as possible. We will have 7 teens per shift on each day, Monday, Tuesday, Wednesday, and they will be every other week. And that is a change from years past where we've had up to 20 teens per shift. So each and every one of you is going to be critical to our success of getting everything done. So we ask that you let us know as soon as possible if you cannot come in so we can get a sub, and that you be really committed to being there, that those days are on the schedule, and also be committed to making sure you're checking your schedule and knowing what days you're here. There are a couple Mondays that are holidays, so it kind of shifts the schedule a little bit. We will be sending weekly emails from sign up of when you're signed up, and we will be sending weekly emails of when we need subs. So for our teens who are on every other week, but would really love to be here every week, I think there'll be plenty of opportunities for you guys to come in and sub more often than that. So I know it's a lot of information, it can be a little confusing with the schedule changes, so feel free to talk to me in the kitchen or reach out to me anytime. Thank you so much.
Hi, Food for Health volunteers. Welcome back. We're looking forward to seeing you all next week. I just wanted to update you on some information regarding our sub process that is different than we've ever done in the past. Due to COVID restrictions this year, we are anticipating needing a lot more subs. In the past, we've always had our schedule a little overbooked, more people on a shift than we needed, because we always anticipated people being out for illness and things like that. This year, we will not be doing that. We will have the specific number of people we need each shift on the sign up, and just send out a weekly email the week before all the shifts to let all of you volunteers know if you're willing or have availability to take on a different shift in addition to your current one. We will have openings, and you can go on to the sign up to sign up if anything works for you. In addition, because of the schedule changes this year, we do have a lot of openings in our kitchen, mostly on Tuesdays and Wednesdays. If you have friends or family members or anybody that wants to join our team, you can send them my way, and I will make sure to find a spot for them that works. So looking forward to seeing all of you next week. Thanks again for coming back. Bye-bye.
Hi everyone, welcome back. We're very excited to have everyone back in the kitchen. because of the new COVID restrictions, we're not going to be able to do the orientation, so we put together this video for you all. So I'm just going to go over briefly some of our restrictions that we're going to have and requirements. So everything from previous program year is going to apply again. So everyone will be required to wear nice, snug fitting masks that need to go over your nose, cheeks, and chin. We're not going to be allowing bandanas or gaiters that go all across your face. It needs to be double panned. On the entry on the kitchen, everyone will be temperature checked. And if you do read a temperature over 100 degrees Fahrenheit, we will be asking you to go home. And with that, we also have a review of a couple questions when you enter. We're going to post these up. We're not going to be asking everyone individually, but we want everyone to kind of go through this process when they come in. So the questions will be, do you have a fever? Do you have a new or worsening cough? Do you have shortness of breath? Do you have a sore throat? Do you have any loss of smell or taste? Have you been at a gathering of more than 50 people in the last 2 weeks? Does anyone in your household have one of the above symptoms and been exposed to someone who has reported a fever over 100 degrees Fahrenheit or been at a gathering over 50 people? And have you been in contact with anyone tested positive for COVID-19 in the last 2 weeks? If you answer yes to any of these, we are going to ask you to go home and quarantine for 14 days. This is all just to protect everybody in our kitchen and our clients as well. The other part of this, if you did say yes to any of those symptoms or have symptoms or an illness that is related to COVID or any of our previous sanitation requirements, we're going to ask you to stay home for at least 10 days until you are symptoms free of the first appearance, and then at least 3 days with no fever or symptoms. If you have any questions about this, you can always reach out to me, Molly, or any of the staff, and we can explain it more in depth. The last piece that we are going to be implementing is a travel restriction, unfortunately. Because of the surging cases in other surrounding states, we will be following the Chicago 14-day quarantine emergency travel order. We have a link that we'll be able to send to everyone that can review this, but if you do visit one of those states, or if you travel via airline, we are going to ask you to do a 14-day quarantine. Again, this is just for the safety of all the individuals in our kitchen and our clients. I believe that's everything that we need to cover right now. This is going to be a very interesting year. As COVID spikes and goes down, we are going to have to be adaptable. So these restrictions are active now. We may be sending future letters saying that we're going to make some changes, maybe adding, maybe returning to a previous state. So if you have any questions, just please let me know. You can contact me directly or contact one of the staff members. Thank you all, and thank you for being flexible and thinking about our clients and everyone else's safety.